for a drug like osimertinib, that has excellent CNS activity. Patients can have very high response rates, improvement in disease burden in the brain and in the body, and the durability of the brain metastasis response and the systemic disease response can be quite high. So in those cases, I often will consider waiting on brain radiation, especially if the lesions are small and the patient's asymptomatic from the brain metastases, and if the lesions are in locations that are not particularly concerning. So I might consider treating with an EGFR TKI like osimertinib alone in that case. The question of progression and resistance is one that does come up, unfortunately, because even in the cases where we have an excellent drug that has great activity in the brain, resistance still does develop. Sometimes it develops in the body and the brain is still controlled. Sometimes the brain metastases do progress or new lesions develop. So those cases, there are times where if the brain is progressing alone and the body is still controlled, radiation could be considered with continuation of the EGFR inhibitor. That has been looked at more in retrospective studies with earlier generations of targeted therapies, but I think it's still a very reasonable strategy to consider if it's only the brain lesions that are progressing. Otherwise, I think if there's overall progression and it includes CNS progression, there may need to be a change in systemic therapy anyway, and in those cases, if the patient hasn't previously had radiation, or even if they had, radiation probably is still a good strategy for those patients, and then switching their systemic therapies. I think in a case like ALK, for ALK-positive lung cancer, there are several different ALK inhibitors, and even if one has failed, sometimes another one might be effective, even in the brain. So I think that could still be an option for patients, even with progression on an ALK inhibitor, that you might have a next generation ALK inhibitor that could still be effective even in the brain.